variety of reasons people join the Be the Match registry to donate bone marrow. They may have known someone who has a need for a transplant. They may have a family member or friend. The best part of this job sometimes is going to a blood drive where someone says, hey, if I can help somebody, I'll sign up. I don't even have to know what's involved. I'll just do it. The whole process starts with the registration, and that involves cheek swabs where you just swab your mouth, and we get a tissue type from that. You fill out a form consenting to be on the registry, and then you go through various confirmatory typing, health questionnaires, things like that, when you come up as a possible match for somebody. And if you are selected after this very strenuous testing process, then you come to OBI where you have blood work done to make sure that you're healthy and have no infectious diseases. You have a physical at OU Medical Center to make sure you don't have any underlying health condition you're not aware of. We function as the donor advocate, so we are very thorough in making sure that the donor is healthy to donate and healthy enough for the recipient to receive the product. So once all of that is cleared, we have a method of collection called peripheral blood stem cell collection. We call it PBSC. And in order to do that, prior to donation, 4 days prior, you are given a series of injections of a medication that gets your bones to make more blood stem cells than normal, and also to push those stem cells into your bloodstream, at which point we are able to use the machines in our stem cell collection room where we hook you up just like a blood donor would be, except you have a needle in each arm, and the machine filters out your blood stem cells from the rest of your blood and gives you the rest of your red cells and platelets and such back into your body. It's a rather lengthy process compared to a blood donation in order to get enough cells. The filgrastim, the medication that you get for 5 days, could cause some bone aches because your bones are working harder to make more stem cells. And sometimes the collection itself can go into 2 days because we don't want you sitting here for 4 to 6 hours without a chance to take a break, so we might break it up. Then once that product is complete, we have couriers who take the product on an airplane that day and fly it to the recipient that the donor was a match to. There are 10 million donors on the Be the Match program, and it's very hard to find a match, so this donor may have been the only possible person to donate to the patient, and they could be anywhere in the world. So our couriers fly to wherever that recipient is and deliver the product, and the next day they get a transplant of basically the donor's immune system, which helps them beat their disease, hopefully. The risk factors are minimal. With the filgrastim, there could be some bone aches and headaches, as we talked about. They're generally moderate, mild to moderate, and they go away once you donate. And you'll just really feel them maybe for a couple days beforehand.
It's a pretty easy process leading up to it. You know, like she was telling you before, you have to go through the physical, and they do some blood work to make sure you're a good match and everything. But when you come in to actually do it, you just sit in a chair and they hook you up and you just sit there until it's done. For the couple of days right before the donation, you do feel a little bit achy. Nothing extreme, nothing totally uncomfortable, just a little achy. And then once you're done, pretty much all of those feelings go away. I was a little tired throughout the rest of the day. Next day I woke up, felt almost completely normal, just a little tired. And then after that it was nothing, completely normal.